Hey everyone, welcome back to Medician, your trusted medical information channel. I'm Dr. Lin, a board-certified allergist and immunologist. Today, we're talking about one of the most common and impactful seasonal allergies in the spring and summer, grass pollen allergy. For many patients, grass season is far more than a few sneezes. It can mean weeks or even months of nasal congestion, itching, runny nose, and itchy watery eyes that interfere with sleep, school, work, and overall quality of life. Grass pollen season typically runs from April through June, but in warmer regions, it can affect patients nearly year-round. With ongoing climate change and longer growing seasons, grass pollen exposure has become more intense and prolonged. In the United States, an estimated 10 to 30% of children and adults may be affected by grass pollen allergy. Grastek offers a different approach from traditional allergy medications like oral antihistamines and nasal sprays. It is an FDA-approved sublingual immunotherapy tablet for grass pollen allergy, designed not just to control symptoms, but to retrain the immune system itself. Rather than reacting to pollen exposure year after year, the goal is to build immune tolerance and reduce allergic response when pollen counts rise. Although Grastek is made from Timothy grass pollen, Timothy grass is highly cross-reactive with many other common grass, including ultra grass, perennial ryegrass, meadow fescue, Kentucky bluegrass, sweet vernal grass, and red top grass. Because of this cross-reactivity, Grastek can be clinically useful for patients sensitized to other grass pollens. So, what should you know about Grastek? In this episode, I will cover 5 key things: its indication, how it works, how to take it, important warnings and precautions, and its side effects and safety. If you're new here, don't forget to like, subscribe for more science-based medical updates. Now, let's dive in. First, what exactly is Grastek and who's for? Grastek is a sublingual allergen immunotherapy tablet made from standardized Timothy grass pollen extract. It was FDA approved in April 2014 for the treatment of grass pollen-induced allergic rhinitis with or without conjunctivitis in patients ages 5 through 65. Before starting treatment, patients must have objective evidence of Timothy grass or cross-reactive grass pollen allergy confirmed by either skin testing or blood testing showing grass pollen-specific IgE. It is important to note that Grastek is not a rescue medication. It does not provide immediate allergy symptom relief. Instead, it is a disease-modifying therapy intended to change how the immune system responds to grass pollen over time. Second, how does Grastek work? In grass allergy, the immune system mistakenly recognizes grass pollen as a harmful substance. That initial exposure leads to the production of IgE antibodies, creating an allergic memory. With subsequent exposure, grass pollen allergens bind to IgE on mast cells, triggering histamine and other inflammatory mediators that cause sneezing, congestion, runny nose, and itchy eyes. Grastek, a form of allergen immunotherapy, works through a process called allergy desensitization. Instead of targeting symptoms after they occur, it delivers carefully controlled daily doses of Timothy grass allergen under the tongue. Specialized immune cells in the oral mucosa capture and process the allergen and gradually retrain the immune system to respond differently. Over time, immune reactivity to grass pollen decreases while tolerance increases. Clinically, this results in fewer symptoms and reduced reliance on symptom relief medications. Third, let's talk about dosing and administration. Grastek is taken once daily as a sublingual tablet. The tablet is removed from the blister pack with dry hands and placed directly under the tongue where it dissolves completely, typically less than 10 seconds. Do not take Grastek with food or beverage. Patients should not swallow for at least 1 minute and should avoid eating or drinking for 5 minutes after taking the tablet. Hands should be washed after handling the tablet. The first dose must be administered in a healthcare setting under the supervision of a physician experienced in allergy diagnosis and treatment, with at least 30 minutes of observation to monitor for allergic reactions. If tolerated, subsequent doses may be taken at home. In children, dosing should only be given under adult supervision. Treatment should be started at least 12 weeks before the expected onset of grass pollen season and continue throughout the season. For patients seeking long-term benefit, Grastek may be taken daily for 3 consecutive years, including periods between seasons, which has been shown to provide sustained benefit for at least 1 additional grass season after stopping therapy. Your allergy specialist will help determine the most suitable treatment plan. If a dose is missed, do not take a double dose, and patients should take the next dose at the usual scheduled time the next day. If more than 1 dose is missed, patients should contact their allergy doctor before restarting. In clinical trials, interruptions of up to 7 days were allowed, but safety data beyond that are limited. Because severe allergic reactions can occur, all patients taking Grastek must also be prescribed an epinephrine product and trained along with caregivers when appropriate on when and how to use it. Fourth, let's review the warnings and precautions. As an allergen immunotherapy, Grastek can cause serious systemic allergic reactions, including anaphylaxis. Severe local reactions involving the mouth or throat can also occur, and in rare cases, may compromise the airway. Although uncommon, these reactions may be life-threatening. Patients should stop Grastek and get medical treatment right away if they develop symptoms such as difficulty breathing, throat tightness or swelling, trouble swallowing or speaking, dizziness, fainting, rapid or weak heartbeat, severe stomach cramps or pain, vomiting, diarrhea, severe flushing, or itching of the skin. Persistent or worsening mouth or throat symptoms should also prompt drug discontinuation and medical evaluation. Because of this risk, all patients must have access to an epinephrine product and be trained on when and how to use it. If epinephrine is administered, patients should seek immediate medical care and stop Grastek until further assessment. Grastek should not be used in patients with a history of severe local reactions to sublingual immunotherapy or severe systemic allergic reactions. It may also not be appropriate for patients with markedly reduced lung function, severe mast cell disorders, or significant cardiovascular disease, including recent heart attack, unstable coronary disease, uncontrolled hypertension, or serious heart rhythm problems. These conditions may increase risk during a severe allergic reaction or limit the safe use of epinephrine. Patients taking medications that interfere with epinephrine may not be good candidates as well. Eosinophilic esophagitis is another important consideration that has been reported following treatment with Grastek. In general, sublingual immunotherapy is contraindicated in patients with a history of eosinophilic esophagitis. If patients develop persistent swallowing difficulty or chest pain, Grastek should be stopped and further evaluation pursued. Asthma control is also critical. Grastek should not be taken during an acute asthma exacerbation. Patients with severe, unstable, or uncontrolled asthma should not start therapy. Lastly, Grastek should be paused in the presence of active oral inflammation or oral wounds, such as ulcers, infections, cuts, or following dental procedures, until the mouth has fully healed. And finally, let's review side effects and safety. In adults, the most commonly reported side effects in clinical trials were local reactions involving the mouth, throat, and ears. This included mouth, tongue, or ear itching, oral tingling or abnormal sensation, mouth swelling, and throat irritation. Drug discontinuation due to adverse reactions occurred more often with Grastek than placebo, 4.9% versus 0.9%, most often related to throat swelling and mouth itching. Serious systemic allergic reactions were uncommon. In adult trials, about 0.4% of treated patients experienced a treatment-related systemic allergic reaction, with most reactions occurring early, often on the first day of therapy. Reported symptoms included lip or mouth swelling, mouth, ear, or throat itching, sneezing, runny nose, throat irritation, difficulty swallowing or speaking, chest discomfort, and rash. Some patients required treatment with epinephrine, antihistamines, or corticosteroids, and a small number discontinued therapy as a result. In children and adolescents ages 5 through 17, the safety profile was similar. Most side effects were again local reactions affecting the mouth, throat, and ears, including mouth, tongue, or ear itching, oral tingling or abnormal sensation, mouth or lip swelling, and throat irritation. Drug discontinuation rates were low but higher than placebo, 6.3% versus 0.7%. Treatment-related systemic allergic reactions in pediatric patients were rare. In clinical trials, one patient, 0.2% of treated patients, experienced an epinephrine-treated reaction involving lip swelling, mouth difficulty swallowing, and cough on the first day of treatment. The subject was treated with epinephrine, recovered, and was discontinued from the trial. Post-marketing experience with Grastek, as well as with the same product marketed in Europe as Grazax, has included additional reports of mild to severe local and systemic adverse events. Because these events are reported voluntarily from a population of uncertain size, it is difficult to estimate how often they occur or establish a causal relationship to drug exposure. However, they reinforce an important point. Any new persistent or worsening symptoms, especially involve the mouth, throat, swallowing, or breathing, should prompt stopping the tablet and discussing with the treating doctor. Overall, Grastek has a well-defined safety profile. Most patients experience mild to moderate local reactions, while serious reactions remain uncommon. And there you have it, 5 essentials to know about Grastek, an FDA-approved sublingual immunotherapy tablet for grass pollen allergy. By inducing immune tolerance to grass pollen rather than suppressing symptoms, Grastek provides a disease-modifying treatment. With appropriate patient selection, epinephrine readiness, and close clinical monitoring, it can be used safely and effectively. If you found this video helpful, don't forget to like, subscribe, and share your thoughts or experience in the comments below. Thanks for watching, and stay tuned for more evidence-based insights right here on Medician. See you next time.